I want you to do something right now. Swallow once, slowly, and pay attention to what you feel at the back of your throat. If there is a thickness sitting there, a sticky coating that keeps returning no matter how often you clear your throat, I want you to take that feeling seriously. Maybe it is strongest when you first wake up. Maybe it follows you through the day. Maybe it has been there for so long that clearing your throat, sipping water, or reaching for a cough drop has become part of your normal routine. Many older adults try to manage this problem by treating only the surface. They drink warm tea, take honey, avoid certain foods, use lozenges, or assume it must be allergies. Yet the same heavy feeling comes back again the next morning. Here's what I need you to understand. That mucus is not random, and it is not simply something you must accept because you are over 55. Your body does not keep producing a persistent symptom without a reason. Mucus is a protective response. It is your throat's way of covering tissue that may be irritated, dried out, inflamed, or exposed to something it does not like. The mistake most people make is that they keep asking, how do I clear this mucus? But the better question is, why does my throat keep making it? Because if the trigger underneath is still there, temporary relief will never last. Warm water may loosen it, honey may soothe it, and a cough drop may calm the throat for a while, but the problem will keep returning until you understand what your body is trying to tell you. Before we talk about what may be triggering the mucus, you need to understand what mucus is actually doing. I want you to do something right now. Swallow once, slowly, and pay attention to what you feel at the back of your throat. If there's a thickness sitting there, a sticky coating that keeps returning no matter how often you clear your throat, I want you to take that feeling seriously. Maybe it is strongest when you first wake up. Maybe it follows you through the day. Maybe it has been there for so long that clearing your throat, sipping water, or reaching for a cough drop has become part of your normal routine. Many older adults try to manage this problem by treating only the surface. They drink warm tea, take honey, avoid certain foods, use lozenges, or assume it must be allergies. Yet the same heavy feeling comes back again the next morning. Here is what I need you to understand. That mucus is not random, and it is not simply something you must accept because you are over 55. Your body does not keep producing a persistent symptom without a reason. Mucus is a protective response. It is your throat's way of covering tissue that may be irritated, dried out, inflamed, or exposed to something it does not like. The mistake most people make is that they keep asking, how do I clear this mucus? But the better question is, why does my throat keep making it? Because if the trigger underneath is still there, temporary relief will never last. Warm water may loosen it, honey may soothe it, and a cough drop may calm the throat for a while. But the problem will keep returning until you understand what your body is trying to tell you. Before we talk about what may be triggering the mucus, you need to understand what mucus is actually doing. Mucus is not a dirty substance your body forgot to remove. It is part of the protection system of your throat and airways. Every day your body produces a thin layer of mucus to trap dust, bacteria, viruses, smoke, dryness, and other irritants before they can travel deeper into the lungs. When that system works well, you barely notice it. The mucus stays thin, moves along quietly, and does its job in the background. The problem begins when the mucus becomes thicker, stays longer, or is produced again and again because the throat keeps receiving irritation. Your body also has a built-in cleaning system. The lining of your airways contains tiny hair-like structures called cilia. Their job is to move mucus upward and outward so it does not sit in one place for too long. When you are younger, that cleaning process is usually faster and more efficient. But after 55 or 60, the system can slow down. The cilia may not move mucus as quickly, the throat may feel drier, and mucus that once cleared easily can begin to feel stuck. That is why older adults often feel this problem more strongly. It is not that mucus suddenly becomes the enemy. It is that the body is producing protection while the clearing system is no longer working as smoothly as it used to. So if mucus keeps sitting in your throat, the next question is not how to fight it. The real question is what is making your throat need that protection in the first place. This is why the same problem often feels much worse after 55. When you were younger, your throat and airways could usually handle small irritations without making them obvious. A little dryness, a little drainage, a little reflux, or a little inflammation might happen, but the mucus stayed thinner and the clearing system moved fast enough that you barely noticed it. As you get older, that margin becomes smaller. The throat can become more sensitive. The mucus can become thicker. The tiny cleaning hairs may move more slowly. The thirst signal may become weaker, so you may not drink enough water until the mucus has already become sticky. And because many older adults take more medications, one side effect can quietly add another layer of irritation. This is why persistent throat mucus should not be dismissed as just aging. Age may make the system slower, but something is still triggering it. That distinction matters. If you only blame age, you stop looking for the cause. But if you understand that aging makes the throat less forgiving, then you can begin asking the right question. What is irritating it? And for many adults over 55, the first hidden trigger does not begin in the throat at all. The first hidden trigger does not always come from your throat. Very often it begins lower, in the stomach. This is called laryngopharyngeal reflux, but in plain language, you can think of it as silent reflux that reaches the throat. Most people know what heartburn feels like. They think reflux means burning in the chest, sour taste in the mouth, or pain after a heavy meal. But silent reflux can be more deceptive because it may not feel like a stomach problem at all. You may have no chest burning, no obvious indigestion, and no clear reason to suspect acid. Yet while you are sleeping, a small amount of stomach acid can travel upward. As we get older, the valve between the stomach and the esophagus may not stay as tight as it once did. When you lie down after eating, especially after a late or heavy dinner, that valve has to work harder. If acid reaches the throat, even in a tiny amount, the tissue there reacts quickly. Your throat is not built to handle acid, so the body tries to protect it by producing thicker mucus, almost like a coating over irritated tissue. I have seen patients who never complained of heartburn at all. They came in because every morning started the same way. A rough voice, a heavy throat, and 10 or 15 minutes of clearing mucus before they could speak normally. They thought the problem was in the throat, but the timing told a different story. That is what makes silent reflux so easy to miss. The timing of your mucus matters. If it is worse first thing in the morning, that often points to something happening while you sleep. Your throat may be reacting overnight, even if you never wake up, never feel heartburn, and never notice acid. But if the mucus stays with you all day, the story may be different. That pattern often means something is continuing to drain, irritate, or dry the throat while you are awake. This is why I always want people to pay attention to one simple question. Is it worse in the morning, or is it present all day? That answer does not diagnose you by itself, but it gives an important clue. Morning mucus makes us think about what happens at night. All-day mucus makes us look for a source that keeps feeding the throat hour after hour. And one of the most common sources does not come from the stomach at all. It comes from above, from the nose and sinuses. The frustrating part is that this can happen even when you do not feel badly congested, even when you do not have a strong sinus headache, and even when your breathing seems mostly normal. That is what we need to look at next. The second cause comes from above, from the nose and sinuses. This is called postnasal drip, and it is one of the most common reasons older adults feel mucus sitting in the back of the throat all day. The confusing part is that it does not always feel like a sinus problem. Many people expect sinus trouble to mean a blocked nose, strong facial pressure, a pounding headache, or a dramatic infection. But in adults over 55, the problem can be much quieter than that. The nose may feel mostly open, breathing may seem normal, and there may be no severe pain at all. Yet the sinuses can still be mildly inflamed. When that happens, mucus can slowly drain down the back of the throat, hour after hour. You may keep swallowing, clearing your throat, or feeling like something is sitting there, but the source is not really the throat. The throat is only where the drainage collects. This is also why some people feel worse after lying down, after waking up, or during the day when the drainage keeps moving. One mistake many people make is reaching for drying medications again and again. Sometimes they help for a short time, but if they make the mucus thicker, the throat can feel even more coated and difficult to clear. A more useful approach for many people is gentle nasal rinsing with warm saline. This does not just mask the symptom, it helps wash away mucus, irritants, and inflammatory drainage before they keep sliding into the throat. But consistency matters. Doing it once or twice may not change much. Doing it correctly every day for a couple of weeks gives the nose and sinuses a better chance to calm down. The third cause is one many people never suspect, a medication side effect. This is especially important if you take medication for high blood pressure. There is a common group of blood pressure drugs called ACE inhibitors. You may know them by names such as lisinopril, enalapril, benazepril, or other medicines that often end in pril. These medications can be very useful, and many people take them safely for years. But in some adults, they can irritate the throat by allowing a substance called bradykinin to build up in the body. You do not need to remember that name. What matters is the effect. The throat becomes more sensitive. The cough reflex becomes easier to trigger, and the person may feel a constant urge to clear the throat, cough, or bring something up, even when there is not much mucus actually there. This is why the symptom can be confusing. It may feel like mucus, but the deeper problem may be irritation. The timing is also important. This side effect does not always appear in the first few days. It can show up weeks or even months after starting the medication, which is why many people never connect the two. So if your throat symptoms began after a blood pressure medication was started or changed, write down the timeline and bring it to your doctor or pharmacist. Do not stop the medication on your own. Blood pressure control matters. But it is reasonable to ask whether your medicine could be contributing to the throat irritation and whether another option may be safer for you. The fourth cause sounds simple, but it is one of the easiest to miss: mild dehydration. Mucus is made mostly of water. When your body has enough fluid, mucus stays thinner, smoother, and easier for the throat to move. But when you are even slightly dehydrated, that same mucus can become thicker, stickier, and harder to clear. This is why some people keep saying, "I drink water and it helps for a few minutes, but then the mucus comes back." The problem is not that water does nothing. The problem is that the throat has already become dry, the mucus has already thickened, and the body may have been running low on fluid for hours. After 55 or 60, this becomes more common because the thirst signal is not always reliable. You may not feel thirsty even when your body would benefit from more fluid. Coffee, certain medications, dry indoor air, and sleeping with your mouth open can make the problem worse. Think about what happens in the morning. You have gone all night without drinking, your mouth may be dry, and mucus has had hours to become thicker. Then you wake up with that heavy, sticky feeling in the throat. A simple first step is to drink warm water before coffee in the morning, then continue sipping fluids throughout the day instead of waiting until you feel thirsty. If you have heart failure, kidney disease, swelling, or a fluid restriction, ask your doctor how much fluid is safe for you. The goal is not to flood the body. It is to keep mucus thin enough to move. The fifth cause is one most people never connect to the throat: the gut. At first, this may sound strange. If the mucus is sitting in your throat, why would the gut matter? But the body does not work in separate rooms. The digestive system, immune system, and respiratory system are constantly communicating with each other. Inside your gut, there are trillions of bacteria that help train and regulate your immune response. When that balance is healthy, the immune system is usually better at staying calm and controlled. But when the gut microbiome becomes disrupted, the body can become more reactive and more inflamed. This matters because the airways respond to inflammation. If your body is already in a more irritated state, the throat, nose, sinuses, and lungs may react more strongly to triggers that would otherwise be mild. A small amount of reflux may feel worse. A little postnasal drip may become more bothersome. Dryness may create more discomfort, and mucus may be produced more easily as part of that protective response. This does not mean every person with throat mucus has a gut problem, and it does not mean a spoonful of yogurt will suddenly clear your throat overnight. But it does mean the gut can influence the environment in which mucus is being produced. A diet low in fiber, high in sugar, repeated antibiotic use, chronic stress, and very little fermented food can all affect the gut microbiome over time. So when mucus keeps returning, we should not only ask what is touching the throat directly, we should also ask what is making the whole body more reactive. Here is the part most people miss. Persistent throat mucus is often not caused by only one thing. In older adults, these causes can stack on top of each other. A small amount of silent reflux may irritate the throat while you sleep. Mild dehydration may make the mucus thicker by morning. A little postnasal drip may keep adding mucus from above during the day. And if a medication is making the throat more sensitive, every small irritation can feel stronger than it should. That is why one simple remedy often fails. You drink warm water and the mucus loosens for a short time. You take honey and the throat feels calmer for a while. You use a cough drop and the urge to clear your throat decreases for a few minutes. But then the same feeling comes back. Not because those remedies are useless, but because they are only touching the surface. They are not asking what keeps feeding the symptom underneath. This is why you need to look at the pattern. Is it worse in the morning? Does it stay all day? Did it begin after a new medication? Is the mucus thick and sticky? Do you also have nasal drainage, hoarseness, or throat irritation after lying down? The answers matter. Because the goal is not to fight mucus blindly. The goal is to trace it back to the layers that are keeping your throat irritated. Before you try to manage this at home, there is one thing we need to make clear. Most throat mucus is not dangerous, but certain signs should not be ignored. If you see blood in the mucus, if swallowing becomes harder over time, if you are losing weight without trying, if you feel a lump or swelling in the neck, or if your voice has changed and does not improve, do not treat that with honey, water, or cough drops. Make an appointment with your doctor and get it checked properly. But if you do not have those warning signs, the next step is to match your action to the likely cause. If your mucus is worst in the morning, start with a nighttime routine. Stop eating at least 3 hours before lying down, avoid heavy late meals, and raise the head of your bed slightly with a wedge or proper incline. Extra pillows usually bend the neck. They do not solve the reflux problem well. If you feel drainage from the nose or mucus sitting behind the throat all day, consider daily saline nasal rinsing for at least 2 weeks. Use sterile, distilled, or boiled and cooled water, not straight tap water. If you take blood pressure medication, especially one ending in pril, do not stop it yourself. Write down when the medication started and when the throat symptoms began, then discuss it with your doctor or pharmacist. If the mucus feels thick and sticky, begin with warm water in the morning before coffee, then sip fluids steadily through the day. And if your diet is low in fiber or fermented foods, start improving the gut environment slowly. The key is this: do not try random remedies forever. Follow the pattern, choose the right first step, and give your body consistency. So here is what I want you to remember. That mucus sitting in the back of your throat is not just an annoying symptom. It is a signal. Your body is trying to protect tissue that keeps getting irritated, dried out, inflamed, or exposed to something it does not like. And if the mucus keeps coming back every morning or stays with you all day, the answer is not always another cough drop, another spoonful of honey, or another glass of water. Those things may help for a short time. Honey can soothe the throat. Warm water can loosen thick mucus. A lozenge can calm irritation for a few minutes. But none of them can fix the real problem if the trigger is still there. If silent reflux is irritating your throat at night, you need to address the reflux pattern. If postnasal drip is feeding mucus from above, you need to support the nose and sinuses. If a medication is making your throat more sensitive, you need the right conversation with your doctor. If dehydration is making mucus thick, you need consistent fluids through the day. And if inflammation is being fueled from the gut, you need to think beyond the throat. This is the difference between chasing symptoms and understanding them. You do not need to panic, but you also do not need to accept this as just aging. Persistent mucus is your body asking you to pay attention. Listen to the pattern. Look for the cause. Take the right first step. Because once you stop treating mucus like the enemy, you can finally begin addressing what your throat has been trying to tell you all along.